Hi, my friends. Welcome to OSCE with Ghazal. Sorry for delay. I was little sick, so I was not posting a video. But today, let's solve a case together. So, in this case, you are getting a patient profile. Patient is bringing a new medication, and the reference material you are getting is, you can see some pages from the diabetes guideline, and also the monograph of Genumet. That's a new medication. So I will not solve a case as we do in the OSCE, but I will go over each point that how you will solve, and that way you will get an idea. So here we have a patient named Matthew McDonald. That doesn't matter. Age 48 years, A1C 9%. This gives you an idea that it's about diabetes, right? When you get the A1C. Fasting blood glucose or and the random allergies, peanuts and grass, medical. This is what you have. The medical condition diabetes and references Genumet. Okay. The patient walk in with a prescription and hand it over to you. So what you will do? You will ask, "Hi, my name is Ghazal. I am a pharmacist. How can I help you?" "Okay, I just want to get this new medication filled. Please have a seat just to make sure that this is a private and confidential area, and whatever we discuss will remain completely private and confidential. Before I go ahead and fill your prescription, is there any other concern you have?" "No, you just want to get this filled?" "Okay." And then you will see the prescription and then start interviewing. "Is it okay if I ask you some question about because your medication you are taking, because it is important for me to make sure that this medication is accurate for you." After getting patient permission, then start. "Okay, so prescription is for Matthew McDonald and you're 48 years old. um okay, Matthew, are you allergic to any medication, any uh, environmental or any seasonal allergies?" Then he will tell you about the peanut and grass allergy. Okay, Matthew, I can see on your profile that you have diabetes and hypertension. That's a high blood pressure. Are they under control? No, they are not under control. My A1C was 9 last time. That's why my doctor is giving me this new medication. I hope this helps. I also think, Matthew, can we just go over what medications you take on the regular basis, like prescription medication and over the counter? Okay, in your profile, I can see that you are taking metformin 500 twice a day, diamicron 660 milligram, 2 tablets daily. Are you taking it in morning? Okay. Rosuvastatin, that's I believe for cholesterol, and you take every day. Aspirin 81 milligram every day, and Ramipril 5 milligram, that's for blood pressure. Is blood pressure under control, Matthew? Okay. So are you taking anything over the counter other than aspirin? No. Okay. Um, some vitamin D. Okay, that does make sense. So you said that A1C was not controlled and doctor is giving this. Okay. We will also review some targets of A1C once I get your medication ready. Other than this, Matthew, sometime lifestyle also affect the way you take your medication. So are you smoking? Ever smoked? No, that's good. What about your caffeinated drink? Do you drink coffee? How many cups? Okay, 2 cups a day. Okay. And what about the alcohol used? Minimal. Socially? Okay. And are you doing some exercise? And no, you are going to increase it. Okay, we will discuss about it. Just moderate forms you're doing, like how many minutes walking? 20 minutes of walking a day. Okay. Slow walking. Okay, just walking your dog. Okay, that does make sense. What about diet? Are you eating diabetic friendly, vegetarian, or eating all? So you eat everything and try to control your sugar. That's good. Let's see what your doctor is giving, and just give me some time. I will check my reference as well if that's okay. and then you will go and check the new prescription is Genumat and one tablet twice daily. Doctor is dispensing 30 days with 2 repeats. Once you see it, you can see that Genumat is a combination of sitagliptin and metformin, and you will identify that patient is already taking metformin, so that needs to be stopped, right? Because it's same dose, but doctor is basically adding the sitagliptin part to control the sugar, and patient is already on the gliclazide. So you have to counsel on this point. This is very important. If you don't, then you are putting the patient at risk because he will be overdosing metformin, then side effects and hypoglycemia, everything will be there. Then you will counsel on the medication. So let's do it. Okay, Matthew. So let's go back to prescription. So your doctor is prescribing you a new medication that's a Genumat before counseling you how you will be taking it. Just to let you know, this is the combination of medication you are already taking, the metformin, along with some other ingredients. So I'm concerned. You just have to stop taking metformin, and I will also fax your doctor about it because it contains the same ingredients, so you just don't need to double it up. And then the new medication, you just, it's a combination of two medications, two components that called sitagliptin and metformin. And then one metformin is the same 500 milligram and sitagliptin part is 50 milligram. You will be taking one tablet 2 times a day. So I would say after breakfast and before bedtime is a good idea. Um, the way this medication works, it comes in oral anti-hyperglycemic agent, and it will control your glycemic. It will give a glycemic control. Will help when your doctor will do the A1C after 3 months. Hopefully, it will bring some of it down. And the most common side effects with or without food doesn't matter, but you can take it same time every day, and in order for this medication to produce effect, it is very important that you take it on regular basis.